I knew that my lifestyle wasn't equal to what I looked like. No matter what I did, I actually restricted my food intake by getting a lap band. I was always very, very active. You know, I have a very active job. I was always into sports. I worked out. I hired a personal trainer. I was 80 pounds heavier than I am now. I was at my top weight. Hired a personal trainer, and I worked out with him 6 days a week. He saw what I did, and he was perplexed. He saw what I ate, and then I would go after working with him 5 to 6 a.m. I would go and do a 13-hour shift from 7 a.m. to 8 p.m. And in the whole year I did that, I lost 6 pounds. So I knew there was something wrong. So I researched, and I almost became obsessed with it. I was on the computer one day saying, and I just put in the toolbar, painful legs, column-like legs, legs that hurt, legs that are hardened, and I found lipedema, and I was shocked. I was absolutely shocked, and then I was educating my family about it, and they were very skeptical. They just thought I was getting obsessed with something. But then they saw the photos I was finding and what I looked like, and they knew my lifestyle also, and they said, you're onto something.
So I think Dr. Diane and I both want to just sort of hear from you what's been going on, what's happened so far, what's bothering you, and what you want us to look at.
So I have lipedema. I've had it since puberty, since I was about 12, between 12 and 13. I had huge lumps that developed in my hips.
Are you having pain in your legs at all, or you said in your feet? I think.
Well, I have a heel spur in my left heel. So once I get up and moving, I'm very active. I work out, I walk a lot, and if I do 4 miles, I'm fine during those 4 miles. But then when I get home, I'll get up, and if I have to go to answer the phone, like I have to hop. It's so sensitive where if I'm sitting on my couch and my 16-pound dog walks across my legs, it hurts. Like or if somebody touches my leg and they're not even putting much pressure, I go through the roof if I get a blood pressure taken. Like, it's sensitive. Kind of used to the pain because I'm in pain every day of my life.
And have you had any swelling in your feet or ankles or anything?
The foot is always fine. The swelling goes from my hip all the way down to here, but it's always a normal foot.
Well, it's very interesting. This swelling in the lower extremity is often misdiagnosed. Fluid down here is not necessarily caused by what we would call lymphedema. You can have certainly swelling, pitting edema from venous hypertension, from venous insufficiency. And you may have a little venous insufficiency, but you don't have what we would consider venous stasis changes in your leg, or the fluid swelling, which often goes into the foot. Lipedema does seem to be what you have, but without a component of lymphedema, which can occur. We do know that in lipedema, and even after surgical procedures, there can be subclinical abnormalities in lymphatic clearance, which could make you more prone, and there could be localized areas, and it may not be that you have lymphedema here, but as Dr. Diane pointed out, you may have some from the prior surgeries in this region and or here, and just an area that may be less prone to clearance. Minor abrasions and things can allow bacteria to get in there. We would be interested in doing a SPY evaluation at some point to look, and might consider some other things, but we'll probably discuss that.
The SPY evaluation, is that what you call it? That would determine whether I have any lymph node involvement or lymphatic?
Lymphatic, it's a very sensitive test for lymphatic disruption. It gives us a good sense of how lymph is moving through the extremities. And to the extent that we can see it in the superficial lymphatics, sometimes it can get deeper. When the lymphatics get deeper, it's harder to see. So, but if you have obvious abnormalities in the subdermal lymphatics, we can see that usually fairly clearly. So, every patient is different, and so whether it's, and with lipedema, the diagnosis is not always as defined, and I think yours is a little clearer. So I think what we would like to learn from you in the process is something that could be helpful for all patients with lipedema. That's why the workup would be helpful.
My hopes for the next step in treatment of lipedema is to eventually get liposuction. Before I get liposuction, water-assisted liposuction or tumescent liposuction, whichever suits my lipedema, I would have to get a SPY test which would indicate whether I have lipolymphedema or not. And if it's just plain lipedema, I believe I can go ahead and get tumescent liposuction or water-assisted, and hopefully the size will go down of my legs. I will be able to maintain my mobility and free myself of pain. I think the surgery is a direction I would like to follow because up until now there has been no treatment and no cure. And this is a huge breakthrough because when I, as a nurse, see older people that have not been officially diagnosed with lipedema, but I believe they do have lipedema, I see that they have very, very limited mobility. They have skin breakdown. A lot of them are bedbound and chair-bound, and I would love to avoid that in my future and be able to maintain my mobility as well as I can. 5 years ago, when I began to do research on lipedema, there weren't many articles, and the articles seemed to be the same ones all over again. And at the end of each article that I read, there was a paragraph that said, "Unfortunately, there is no treatment and there is no cure." And I had no hope. For the first time ever, I am able to tell them that now there is hope, and there is hope because of surgical treatments and modalities, and there are surgeons like Dr. Smith and Dr. Diane and people like Catherine Sayo who have done so much research and support groups and German doctors. So now that there is hope, where up until now there has been no treatment and no cure.